So we are here gathered today to engage and dialogue with the private sector. We have a number of private sector practitioners who are here, but also we have people who are supporting the private sector indirectly in terms of programs, social corporate responsibility, but also those who are working at the community level. And the idea today was to meet with them and review the commitments they have made around the reproductive, maternal, newborn, child and adolescent health sharpen plan. So today is an exercise of taking stock. We're trying to do a harvest exercise to see how far have they gone, what are the bottlenecks, and how can we forge a way forward.
The private sector plays a very big role. Increasingly, they are playing a very big role on issues to do with the health service delivery. But specifically on reproductive, maternal, newborn, child and adolescent health, they play a major role in terms of provision of services, especially in hard-to-reach areas and in rural settings.
You know, after the 2015 MDGs, we were not seeing any improvement in maternal health. So GFF came into being, support countries, how we were able to invest into maternal services, child services, how can reduce the maternal mortality and the infant death. So we are there to raise resources first of all. So partnering with our government to raise resources for improving services for mothers and children and newborn.
So without any strong dialogue and collaboration and partnership with the private sector, we cannot, to a larger extent, move faster towards universal health coverage and even beat the deadline for the Sustainable Development Goals 2030.
It can't be support supervision once a year, you call it services, quality services.
In the southwest of Uganda and the west of Uganda, where they combined mentorship on those programs, many of the health outcomes actually improved.
It's very interesting. A lot of the focus indeed tends to go to the rural. A lot of the programming is for the rural areas, and yet indeed some of the very hard to reach people are right next to us.
The challenge we have though is that people are procuring criminal abortions.
We're in 25 districts, and in Eastern Uganda, the Busoga districts is where we see a lot of traditional birth attendants. Those are the kinds of the practices I'm talking about, which need to be regulated. But the question to me is, why do women run to these people, not the health facilities?
I think it's time for us to really now just discuss where do we want to go, and I've highlighted the 7 areas again.